My name is Alyson Contakos. I am a family nurse practitioner and I'm the manager of our clinical education department here at Paragon. I have been practicing nursing for 16 years now. I started out in the hospital and then I worked in family practice as my first job out of nurse practitioner school. I was kind of ready for a career choice and I happened to run into a former colleague and said, "Hey, what are you doing these days?" And she goes, "Oh, I work for this place called Paragon. We do specialty infusions for patients with chronic diseases." And 6 years later, here I am. My day-to-day looks very different depending on the week. I do lead a training class for all of our infusion center clinical staff and patient access staff as well. The classes are aimed at how to develop safe, competent nurses who can take great care of our patients and breaking it down to the very foundation of the medications, how they work in the body, what can we expect when we administer this medication to a patient. How do we manage anything that might go wrong? Those are all things that we want to make sure our staff feel really comfortable with before they get into that clinic setting with patients. There is a massive learning curve in the area of specialty medicine. It's definitely something I experienced when I first came on to Paragon. Thankfully, Paragon does have tons of resources and invest a lot of time, energy, and resources in our staff to ensure that they have what they need to provide safe, evidence-based clinical practice, regardless of their setting, whether they're in an ambulatory care center or in a patient's home. Some programs that Paragon offers for staff, for full-time nurses, they offer free membership to Infusion Nurses Society, which is a wonderful organization that really guides a lot of our clinical practice. They have the infusion therapy standards of practice, which we utilize heavily. Also, as part of that membership, there is access to Journal of Infusion Nursing. They have their newsletter, there's podcasts, webinars, continuing medical education that staff can do for free, and that's all part of their membership that Paragon provides. And there's others. We really do invest in our staff and making sure that they have all the tools that they need to make safe decisions. Paragon is one of the best infusion institutions from a clinical standpoint. I know these things because I've worked with our clinical team closely and I see the level of detail that we put into all of our policies and procedures to ensure that our patients are safe and that our staff are safe too. We have so many nurses that have CRNI certifications, IG certifications. Many of them have both. And that's just not something that you see often where people are proactively going to get another certification. Those are not easy to obtain. So that's a really cool thing to be a part of and to see that we are an organization where our nurses love what they do and they really do invest in themselves, which ultimately invests in our patients. So that's why I love it here. My name is Alyson Contakos and I am Paragon proud.